In lesson 4, we're going to look at socioeconomic disparities in healthcare. We're going to use surgery, the demand for surgery, as an example to explore this. In a city named Mountain Bay, there are 1,500 elites who reside in upscale enclaves with million-dollar views, 30,000 commoners living in suburban neighborhoods, and 24,000 minorities living in poverty-stricken urban centers. Elites are willing to pay up to $10,200 for surgery. Commoners are willing to pay up to $5,100. And low-income minorities are willing to pay just $1,020. Willingness has a lot to do with ability. So when you are talking about willingness to pay, you're also kind of talking about the ability to pay. And of course, the wealthier you are, the more able and willing you are to pay. Using these maximum willingness to pay values, complete the following table below. So what I'm going to do is I'm going to copy this table to Microsoft Excel. Now to get the quantity demanded, let's do this. We're going to type the number, then we're going to do elites, commoners. Commoners is another name for like middle income people. And then the poor. The number of elites in this community, 1,500. The number of commoners, 30,000. And the number of poor, mostly minorities living in poverty-stricken urban centers, 24,000. Now, only these 1,500 elites can afford the surgery at 10,200. So quantity demanded at that price is just 1,500. Now, quantity demanded at this price, well, these 1,500 elites, if they're willing to pay 10,200, then they're plenty okay with spending less, 5,100, right? So we're going to add this number to the number of commoners who are willing to pay at most $5,100. And then everybody, elites, commoners, and poor, are willing to pay $1,020. So if this was the price of knee surgery, everybody would be willing to pay that, right? Poor, commoners, and elites. If this is the price of the surgery, then just the commoners and elites would be. And then if this is the price, then only the elites would be able to pay for the services, right? And these are the quantities that are demanded. So we have 1,500, we have 31,500, and we have 55,500. And your numbers are going to be different than mine because we all have a different solution, right? Now we're going to copy, after copying that stuff from Excel into the lesson, what we need to do is we need to create a trend line so we can get an equation for the demand curve, right? Now, we have quantity demanded in column A, and we have the price in column B. In Excel, the numbers on the left are going to be assumed by Excel to be values on the x-axis. And the values on the right are going to be assumed by Excel to be y values. So if I highlight this column and that column, and then I go up here to insert and I choose scatter plot, I get these three dots that appear to be on the same line. And the line would be downward sloping. Now notice that price is in fact on the y-axis and quantity demanded is on the x-axis. So I'm going to call this demand. Then I'm going to right click on a dot here and I'm going to click add a trend line and click on display equation on chart. Okay, now before I leave, I'm going to go over here. It says label options, and we need 4 decimal places. So I'm going to change that to number and change that to 4. So this is our demand equation. Y again is our price, right? The y-axis is the price. X is the quantity axis. And we're multiplying quantity times this negative number. So this negative number is the slope. So I'm going to copy that. I'm going to paste it right here. So we got the variable Q times this negative number equal to P after we add the intercept to that product, right? And the intercept is 10,455. I'm just going to copy to the decimal place. I'm not going to copy the decimal values. And then I'm going to get rid of the comma. Math doesn't like the commas. So we got 10,455 plus the quantity times this negative number equal P. This negative number means the relationship between Q and P is negative, right? So let's press enter. Now, we've done this before. We want to find the max price to consumers with the highest willingness to pay, what that is, right? And so what we're going to do now is I'm going to copy this equation again. I'm not going to copy the y. I'm going to copy the equal sign all the way to 10,455. And I'm going to paste that right here. Okay, the first thing I have to do is I have to replace x with times. And I want, I'd like to type Q, but what I'm going to do instead is I'm going to click on cell A6 because that's where I'm going to put quantity demanded to answer these series of questions. So what this is going to do is going to take whatever's in this blue box, it's going to multiply it by this negative number. So if A6 were, say, 1, if 1 was in this blue box, this whole thing would be a negative 0.17. And then we'd add it to this 10,455. Again, I want to get rid of the comma. Excel doesn't like commas either. I'm going to hit enter. Now, when I hit enter, since there's nothing in the blue box, Excel assumes that it's 0, right? So we're going to take 0, replace A6 with it, multiply by that negative number. Well, that's 0, and 0 plus the intercept is going to be 10,455, right? And we're going to use this to calculate these numbers here, right? So the maximum price the consumer with the highest willingness to pay is what? Well, the person that has the highest willingness to pay, you can think of them as being the first in line, right? So you can, the demand curve, what it is we order people along the demand curve. We order them from the person that has the highest willingness to pay to the second highest willingness to pay, down to here, right? And we keep going until we get to the end. This person down here has the lowest willingness to pay. This is a poor person. This is a middle income person. And this is the richest person. The richest person has the highest willingness to pay. And you can think of all these dots as the people that are in this queue, this line, right? And they're ordered from the highest willingness to pay to the lowest willingness to pay, right? So the person that is willing to pay the highest amount of money for this service is willing to pay up to $10,454.83. That's what they're willing to pay. Now, the price that is paid by that consumer is what? Well, if you notice up here, we're assuming that the initial price of the surgery is $10,020, right? So the way you interpret this is this person who's first in line, who has the highest willingness to pay, is willing to pay almost $10,500 for the surgery, but they only have to pay $1,020. That's a total win for this consumer, right? They walk away from the transaction feeling pretty good because they're willing to pay almost $10,500, and all they got to do is pay $1,000. So they're feeling pretty good about it, right? And we call that the first consumer surplus, right? So I'm going to put CS here. So to calculate consumer surplus, we're going to take the difference of the price the person's willing to pay minus the price that they end up paying, $1,020. And that equals $9,435. Let me see if there's any decimal places. Okay, there are. I want to get rid of the comma and the dollar sign to make it easier to copy and paste. Now, what about the person who's second in line? The person with the second highest willingness to pay? Well, all I have to do is pull this down. Because what's happening here is I'm taking this same slope, which is negative 0.17. I don't need the 0, there. We're multiplying it by whatever's in A7, which is 2. And then we're adding that to our intercept, right? Which was $10,455 dot 0000, right? And so this person second in line is willing to pay up to $10,454.66. Now this person only has to pay $1,020. That's what the initial price is, right? Now, in order to calculate the consumer surplus, what I'm going to do is I'm going to freeze this red box in row 4. I'm going to put a dollar sign between the B and the 4. I'm going to drag this down. And when you do that, what happens is it freezes, like I said, this red box in row 4, but allows the blue box to rotate down, right? So when the price is $1,020, but the person is willing to pay up to $10,454.66, that feels pretty good to that consumer, right? And that feel goodness, if you will, is what we call the consumer surplus, right? It's the difference between the price that you're willing to pay and the price that you get to pay, right? And then we replicate that again. We're going to do the third person in line, the person with the third highest willingness to pay. And that person is willing to pay, right? This third person, right? We multiply that 3 in A8 by this negative number. So whatever 3 times negative 0.17 is, we're going to add that negative number to the intercept, and we get a maximum willingness to pay of $10,454.49, right? Again, that consumer only has to pay $1,020, right, for the surgery, which means that person's consumer surplus, which is the difference between what they're willing to pay, in this case, $10,454.49, less the price they, end up paying, $1,020, right? So notice the consumer surplus is falling. The consumer surplus is falling because as we go down the demand curve, the maximum these people are willing to pay is falling. Now, the maximum price the marginal consumer is willing to pay, the marginal consumer, when the price is $1,020, the marginal consumer is the 55,500th consumer. That's the marginal consumer. So what I'm going to do here is I'm going to put a yada, yada, yada in here. So we're going to go from the first, the second, the third, and then we're going to skip ahead to this last consumer, the marginal consumer. This marginal consumer is willing to pay, this 55,500th consumer, we multiply that number by the negative coefficient, we add that to 10,455, and we get the maximum price we want to pay, which is $1,020. The marginal consumer is the one where that person's consumer surplus is 0, because what they're willing to pay, the most they're willing to pay, is the market price. So in a sense, this very final consumer is indifferent between the knee surgery, which will cost $1,020, and not having the knee surgery, which just means they have to live with a bad knee, right? They're indifferent, right? The marginal consumer is the one that has no consumer surplus, because what they're willing to pay equals what they get to pay, right? And so they're indifferent. Now, total consumer surplus, if you really think about what total consumer surplus is, if you imagine these dots are people, right? The price down here along the demand curve, let me delete this trend line real quick. This dot down here corresponds to a price of 1,020 for the knee surgery, and that 55,500 consumer or patient that needs a knee surgery, right? That's demanding knee surgery, right? So the consumer surplus is the area that's under this demand curve all the way to the y-axis. So all the way up here to the y-axis, then down along the y-axis to the height that is 1,020. The white triangle that's above this line that you can't see, that's under this demand curve, that's to the right of this y-axis. The area in here is the consumer surplus. And we can find that by doing what? By calculating all 5,000 or 55,500 of these consumer surpluses and then summing, right? That's one way to do it. That would take a long time to do that, right? It would take a long time to do that. Instead, what we're going to do is we're going to take the intercept, right? We're going to take the intercept here. We're going to subtract off the market price of 1,020 to give this the height of this triangle. And then we're going to multiply it by what? The number of people who want the knee surgeries at a price of 1,020. And that is 55,500, right? And then we're going to divide that product by 2. Right? And so let me do it right here. So the total consumer surplus is the intercept, right? The intercept right there, 10,455 minus the market price, 1,020. That gives you the height of the triangle. We're going to multiply that by that quantity. That gives us an area of a rectangle. We divide the area of the rectangle to get the area of the triangle. And we get a consumer surplus equal to, change it to number. Now, this says $1 million, right? We've converted this to millions of dollars. So if I change this, if I add a comma there, you can see that if I change this comma here to a decimal place, this would be $261.82 million, right? So that's the consumer surplus. It's the area of the triangle between the y-axis, the demand curve, and the horizontal line that corresponds to a price of 1,020. It provides a measure of total benefit that accrues to, well, elites, right? Elites, who is buying knee surgeries at this price? Elites, commoners, and the poor, right? So it provides a measure of the total benefit that accrues to all consumers, right? Elites, commoners, and the ethnic minority who live in the poverty restriction inner city. Assuming willingness to pay and income are perfectly correlated, and the demand line represents a queue of consumers who are ordered from the highest willingness to pay, the point on the left of the demand curve, to the lowest, the point that's on the right of the demand curve. The marginal consumer here, we've already talked about that, right? The marginal consumer is this very last ethnic minority that lives in a poverty-stricken inner city community, right? So the marginal consumer here is a low-income minority. Now, if you read these articles, and you can click them right here to read the article. So you have Race and Medical Licensing Laws by Jeffrey A. Singer, MD. And then you got excerpts from Race and Economics by Professor Walter E. Williams. this book is really fascinating history history is usually written by the victors. Well, this history is not written by one of the victors, right? Walter Williams was not a victor, if you will. I mean, in his personal life, he was a victor because he grew up in the segregated neighborhoods of Baltimore. And I think he ended up getting his GED, or he graduated from high school and he went to the Marine Corps, I think, or the Army. I think he was in the Army. And he got he got exposure to the government via the military. He went off to UCLA eventually and got a PhD in economics. So he came from very humble beginnings, very impoverished. I think his mother was divorced, so he grew up in a broken home. I think he had a brother. But in terms of like news media and politics in general, I would say he was not what you would consider a victor in mainstream thinking history, right? So it just provides a really interesting history of race and economics in the United States. I highly recommend the whole book, right? I provide you with that link to give you a sample of what you're going to find in the book. And I think if you end up getting the book, I think you're going to be pleasantly surprised by the history that you read there. Right. So these two articles reveal that occupational licensing will reduce is a little too strong. We'll just say can limit, right? It doesn't increase it. And you can't really say it has no effect, right? What we can say is it can limit it, right? There are probably situations where that has no effect, but that's not true for all cases. Just like will reduce is probably the case most of the time, but you might be able to find very rare instances where there was no reduction. So let's say can limit the number of people working in a licensed occupation. Now, suppose Mountain Bay institutes medical licensing and issues only 350 surgical licenses. If each licensed surgeon can perform at most 100 surgeries in a month, the maximum number of surgeries that can be performed each month is what? Well, we're going to multiply this 315 times 100. When you multiply 315 times 100, you move the decimal place 2 places to the right, 1, 2. Then the resulting price of surgeries would be what? Well, let's go over to our table over here. Oh, it just so happens that this number, it's not a coincidence, by the way, I made it happen. This number and that number are identical. That's the most surgeries that is possible in this Mountain Bay metro area, right? 31,500. So if that's the most that can be performed, then the price, and if that's what's performed every month, then the price will be $5,100. And we're going to use this information to answer the questions below. Okay, so what we're doing here is a repeat of what we just did, right? Except now the price of surgery is no longer 1,020. Now it's 5,100, right? So what we have to do here for the consumer surplus is we have to change the market price from 1,020 to 5,100 for all these, right? So I'm going to drag these down. And then only 31,500 surgeries can be done, right? So we have to change this from 55,500 to 31,500, right? And notice that this price is 5,100. Would that make sense? Because why? Because if this is the most, that's the most number of surgeries it can do in a month, the last person that gets the surgery is willing to pay at most 5,100. So these two numbers, corresponding to these two numbers, is not a coincidence, right? It's just a result of the theory and the math behind the theory, right? Okay. Then I'm going to copy this and paste it down here. So all of these consumer surpluses are computed by subtracting the maximum price consumers willing to pay from the price they end up paying, right? And so consumer surpluses are smaller for these really rich people who are willing and able to pay, pretty large sums for this knee surgery, right? So for this first person, again, the first person is willing to pay, right? This first person is willing to pay that amount of money at most, right? Nothing more. And the price they end up paying is $5,100, right? And the difference in those two is kind of how they feel about it, right? They walk away thinking, man, I got the good end of that deal. Because I would have paid almost 10,500, but I only had to pay 5,100. That's a good deal for me, right? That's what they're thinking. So that's the consumer surplus. So this number is identical to this number up here. But now we have a lower price, right? We have actually we have a higher price. The price was lower at 1,020, and now the price is 5,100. So the consumer surplus is pretty big originally. Now the consumer surplus, this first consumer, is not so big, right? Now, what about the second consumer? The second consumer is willing to pay, right? The second is willing to pay at most $10,454.66. They only have to pay $5,100. That's the market price. The consumer surplus is the difference in those two, right? The person's feeling pretty good because they would be willing to pay that amount, but they only had to pay that amount. And that difference is their consumer surplus, right? That person's consumer surplus. Now, what about the third highest, the consumer with the third highest willingness to pay? Okay, this person will want to pay up to and including that amount for the surgery. But again, they only have to pay $5,100. The consumer surplus from that surgery is what? Well, the difference in those two numbers, right? And then this is the difference in those two numbers. Now, the last person that's able to buy a surgery at $5,100 is the last commoner, right? All these elites and commoners are willing to pay prices that exceed $5,100, except for the very last commoner. The last commoner is willing to pay exactly $5,100, no more, right? And the market price for the surgery is $5,100. So you're at the marginal consumer. You're at the marginal transaction if the consumer surplus and the firm surplus are zero, are both zero. Their sum is zero. That's when you're at the margin, right? So the marginal consumer has a consumer surplus of zero because this person would be willing to pay up to, but no more than $5,100, and ends up paying $5,100. So this person's indifferent between the knee surgery and not having the knee surgery, right? Okay, and this is why it's really important to understand who's populating this demand curve, right? You have the rich up here, you have the middle class commoners here, and then you have the poor people down here, right? Total consumer surplus at $5,100. So we have to fix the consumer surplus calculation. The price is no longer 1,020. The price now is 5,500. I should click. Now, the quantity is no longer 55,500. The quantity now is 31,500, right? So what we're doing is we're calculating the consumer surplus triangle that is made by the downward sloping demand curve that goes to this point here. Let me delete the trend line real quick, right? So we're coming down the demand curve and we're going to what point? We're going to the point that corresponds to the market price now, $5,100. And the 31,500 surgeries that can take place, right, as a result of the licensing laws that restrict the number of doctors to 315. 315 times 100 is 31,500, right? So the most surgeries that can take place is right there, right? So if that happens every month, the price is going to be $5,100 and the quantity supplied is going to be 31,500. So the consumer surplus is the triangle that's made from this dot all the way up to the intercept of the demand curve, down the y-axis, and then from the y-axis on a flat line to this point, which has a height equal to the price, $5,100. So it's the triangle that's above my mouse pointer, right? It's this triangle in here. And it's smaller than this triangle, right? Smaller than the original triangle. So the consumer surplus, again, is the intercept of the demand curve minus the market price. That difference times the quantity demanded. And then we got to divide by 2 because we don't want the area of a rectangle. We want the area of a triangle. Now, since in mild math, we're talking millions of dollars, we have this comma right here. This comma says 84,341,250. So if I think of this comma here as a decimal place, right, this is $84.34 million, right? That value. It provides a measure of the total benefit that accrues to whom? Well, if this quantity supplied, we only get that quantity demanded, which means only the commoners and the elites will pay this $5,100 to get the knee surgery. So the licensing does what? It prices the poor, the ethnic minorities, out of this service, this medical service, knee surgery. So while the elites and commoners are walking around with brand new knees, the minority, the ethnic minorities living in the impoverished center of this urban community, they're walking around with bad knees, right? Because they can't afford the $5,100. So what happens here is the licensing, maybe the licensing, you've read the articles about how licensing in the American Medical Association was initially intended to keep Black people, women, and Jewish people out of the medical profession. The AMA admitted to that a few years ago. It took them like 80, 90 years, or over 100 years, well, about 100 years. It took them about 100 years to admit that their licensing policies, their licensing discriminated against people of color, Jewish people, and women, right? And I mean, did they do that because they're sexist and racist? Well, maybe that had something to do with it. But I kind of think that they did it so that they could limit the number of people in the profession and thereby raise their salaries. Because when you create an artificial scarcity through licensing, now doctors are more scarce. Hospitals need to staff their, hospitals need to staff their hospitals with surgeons and whatnot, right? And it creates a bidding war for these doctor services, which drives their prices up, right? Drives their salaries up. So no longer are the poor able to buy the knee surgery, right? So it provides a measure of the total benefit that accrues to only commoners and elites, right, for their voluntary exchanges with providers of surgeries. Assuming willingness to pay and income, again, are perfectly correlated, and the demand line represents the queue of consumers who are ordered from the highest willingness to pay to the lowest the marginal consumer ends up being the commoner, the last commoner, right? So the implementation of occupational licensing limited the number of surgeons and thereby limited the number of surgeries that can be done each month, which it reduced access to surgeries and it increases the prices of surgeries, right? This resulted in a decrease of how many surgeries among elites? 0. 1,500 elites in my example got surgeries when the price was that, and 1,500 got the surgeries when the price was that. A decrease of 0 surgeries amongst commoners. Well, when the price was this, that's how many people got surgeries. When the price was that, that's how many commoners got surgeries. So it doesn't decrease surgeries amongst commoners, but it does decrease surgeries amongst the poor, right? These two numbers add up to 31,500. All of these people were having surgeries done when the price was this, when there was no licensing. After licensing, the price went up to here. It priced 24,000 poor people out of surgery. So we had a decrease of 24,000 surgeries among poor minorities. Now, according to the Grossman model, the decline in surgeries among low-income minorities increases the rate of depreciation of the health capital of the members of this group. That's what the Grossman model is kind of about, right? That's the whole thing. That's the shebang, right? This is so because not having surgery today means the injury or disease and the pain from the injury or the disease will worsen over time, which increases stress, decreases one's ability to exercise, and can lead to depression. Furthermore, the demand for healthcare 20 years from now among low-income minorities will be greater than it would have been otherwise, resulting in shortages of healthcare growing. Imagine that an Association of American Surgeons hires you as an economic consultant to develop government policies aimed at maximizing their salaries. Based on what you learned above and your strong interest in maintaining your 6-figure contract with the association, which of the following would you recommend the organization lobby the U.S. Congress for? Make medical licensing more onerous means it's going to be more costly, more difficult to get a medical license. That would definitely reduce the number of doctors available. And if you have fewer doctors, you have hospitals and people in general bidding on the smaller pool of doctors, the services of the smaller and smaller pool of doctors' services, right? So that would drive up their wages. Increase the minimum wage. Well, if you increase the minimum wage, hospitals probably hire minimum wage workers, maybe for lawn care or cleaning or whatnot. That would likely shrink their margins. So that's probably not a good thing to do. Repeal certificate of need laws. Well, if the certificate of need laws are repealed, then entrepreneurs will be free to open up doctor offices or hospitals next door to established hospitals. And that competition would pull down prices, shrink margins, and ultimately reduce the amount of salaries that are available, right? Lower Medicare reimbursement rates. Well, if you lobby Congress to lower Medicare reimbursement rates, that's probably good for seniors, but it squeezes the margins of hospitals. So I'm not sure they want to do that. Eliminate hospital subsidies. Well, if a hospital's getting a subsidy, right, their revenues, when that subsidy is taken away, the total amount of money they've collected from subsidies and fee collection for services provided would shrink, right? So really the only one that makes any sense is to make medical licensing more onerous, more difficult.